Hi, I'm Josh Chang. I'm the second author of our paper where we're looking at post-discharge interventions for preventing hospital readmission. In our paper, we identify the survivor bias that plagues a lot of the literature in this field. So what we're dealing with is Medicare claims data, and within the Medicare patient population, almost 20% of admissions are followed by readmission within 30 days. Our objective is to not only assign a probability, a risk score to each admission for readmission, we also want to identify groups or cohorts of patients that are similar enough to where they might respond to an intervention in a similar way. And in doing so, you can match interventions to groups, and in that way, you can implement policy changes more easily. So we have to address the survival bias I mentioned, and that bias arises simply because in order to receive an intervention, you must be healthy enough to have survived, to not get readmitted in time for receiving that intervention. Okay, so if you don't control for this, then you get a phantom effect. You find in the literature a lot of this phantom effect, and it's natural to control for this effect within a survival estimation framework. Our other objective is to produce models that are intrinsically interpretable. We have another paper where we go in detailed discussion on intrinsic interpretability. The key takeaway is that you cannot make a black box interpretable by adding posthoc-explainable methods to it. You don't get a good approximate, you don't get exact, definitely you don't get exact explanation of what the model is doing, but you often don't even get a good approximation. Our methodology is to take the classical multi-level linear regression and reimagine it as a ReLU neural network, okay? Because ReLU neural networks are locally linear. So what we mean by this is using unsupervised methods on the data and to segment the data into many different categorical kind of groupings, and then you fit a model over the groupings. And we developed this hierarchical additive decomposition method. As a result, we have models with very high accuracy. This is on left out data. And also we have heterogeneous effects that are corrected for the survivor bias that I mentioned. And finally, this is who we are. So Sound Prediction is a startup working in the digital health space. And also Epsilon Med, it's our logo for Medarata Research, and we are also a research firm, a nonprofit research firm. So we can use help in terms of supporting either our for-profit or nonprofit. And if you're a hospital, we would like to work with you in either capacity. Okay, thank you very much.